Well, the idea of making this study was a type of discussion we had among researchers, investigators. How can you define a refractory patient? And when you read the paper, you have different type of definition. And to build a new protocol, comparing new technology, we really need to have a stable definition. So that was the main idea. So we put together the study of the CORAL study, international one, the Canadian study, LY-12, and the data of MD Anderson and the Mayo Clinic. And we decided to look at the survival and the clinical characteristic, I would say, of the patient not achieving a response after chemotherapy. Stable disease, progressive disease. And you have three different situations. One is refractory after first line. The second is you get remission, then you relapse, you go to chemotherapy, and at that time the treatment does not work. Stable disease, progressive disease. And as you know, in diffuse large B-cell lymphoma, all the patients relapsing should be submitted, if they are chemosensitive, to autologous stem cell transplantation. Some of them succeed and are cured, some others relapse after transplantation, stable disease and progressive disease. So we look at this cohort of patients through our protocol. We started with 861 patients, and only 635 were eligible according to our criteria. And they were divided in 19 primary refractory, 50 or so secondary refractory, and 17% relapse after transplantation. So we look at that and look at the patient characteristic, the main characteristic, and half of them had a very high score of IPI. All of them, 90%, had disseminated stages, and roughly the majority of these patients are really poor adverse prognostic factor to begin with. So it's not surprising to see that they were refractory. The age of this population is quite young because they were eligible for transplantation, so it's 55. Then we look, according to the type of treatment they receive, chemotherapy, the response rate. And at that time we found that only 26% could respond to chemotherapy, with very few, 8% in complete remission. That means that conventional chemotherapy, whatever the type of regimen you use, is not working for that population. So there is an unmet need to develop a new treatment. So what's happened to this patient? We look at the survival, of course, and for the general group, it was only 6.6 months, the median, very short median survival. And if you stratify according to the definition, primary refractory, post-auto, secondary refractory, you have exactly the same survival. Of course, about 17% can experience a long survival after 3 years. Nevertheless, 90% of these patients are dying very quickly in a median of 6 months. And that means that that's the population where we really need to find new treatment. And at the present time, in diffuse large B-cell lymphoma, we don't have that many treatments. But from this congress, today and tomorrow, you will see that with the CAR T-cell, maybe in diffuse large B-cell lymphoma, we have an hope with an increase of the response rate and a long duration. The study has to be done, but at least now we can compare this population to the refractory one we described.